WHO declares global emergency over new Mpox outbreak. The rapid spread of Mpox, formerly called Monkeypox, in African countries constitutes a global health emergency, the World Health Organization declared on Wednesday. This is the second time in 3 years that the WHO has designated an Mpox epidemic as a global emergency. It previously did so in July 2022. That outbreak went on to affect nearly 100,000 people, primarily gay and bisexual men, in 116 countries and killed about 200 people. The threat this time is deadlier. Since the beginning of this year, the Democratic Republic of Congo alone has reported more than 14,000 Mpox cases and 524 deaths. Those most at risk include women and children under 15. The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying, said Dr. Tedros Adhanom Ghebreyesus, the WHO's Director General. The outbreak has spread through 13 countries in Africa, including a few that had never reported Mpox cases before. On Tuesday, the Africa Centers for Disease Control and Prevention declared a public health emergency of continental security, the first time the organization has taken that step since the African Union granted it the power to do so last year. It's in the interests of the countries, of the continent, and of the world to get our arms around this and stop transmission as soon as we can, said Dr. Nicole Lurie, the Executive Director for Preparedness and Response at the Coalition for Epidemic Preparedness Innovations, a nonprofit that finances vaccine development. Facing the threat of global spread, the Centers for Disease Control and Prevention has urged clinicians and the public in the United States to be alert for the virus. The WHO's designation of a public health emergency of international concern is intended to prompt member countries to begin preparing for the virus's appearance and to share vaccines, treatments, and other key resources with poorer nations. We need concerted international action to stem this recent novel outbreak, said Greg Gonsalves, an epidemiologist at Yale University who served on the WHO's Mpox Committee in 2022. The outbreak that year stayed mostly within tight sexual networks among gay and bisexual men. A combination of behavioral changes and vaccination tamped down the spread. In the United States, for example, the toll dropped to about 1,700 cases last year from more than 30,000 in 2022. The version of Mpox that has been circulating in Congo has always been more virulent and currently has a death rate of about 3%, compared with 0.2% in the 2022 outbreak. The infection can produce fever, respiratory symptoms, muscle aches, and swollen lymph nodes, as well as a rash on the hands, feet, chest, mouth, or genitals.
Until recently, it spread mainly through consumption of contaminated meat, close contact with infected animals and people. Most of the deaths have been in children, who in this region of Africa are already beset by malnutrition and infectious diseases like cholera, measles, and polio. Should the outbreak spread globally, children in developed countries are likely to be less vulnerable to severe illness, said. Last year, for the first time, scientists discovered sexual transmission of this version of Mpox, with cases split about equally among young men and women. According to genetic analyses sometime around September, the virus gained mutations that enabled it to spread more readily among people. It has done so partly through heterosexual prostitution. This viral type has not surfaced outside Africa. Overall, there have been more than 17,500 presumed and confirmed Mpox cases in 13 countries, according to Africa CDC. Most of the cases and deaths occurred in Congo. Given the rapid spread, the declaration of a global health emergency was justified, said Anne Rimwan, an epidemiologist at the University of California, Los Angeles, who served on the 2022 Mpox panel. I think we learned a great deal about the speed with which this virus can spread, said. Amid rising numbers, Congo has approved 2 Mpox vaccines, a Japanese product called LC16 and Jynneos, a vaccine made by Bavarian Nordic that was used in 2022 in the United States and Europe. But Congo has yet to institute an immunization plan. On August 9, the WHO invited vaccine manufacturers to apply for an emergency use listing, a prerequisite for international groups such as Gavi, a global vaccine alliance, purchase and distribute the shots in low-income nations. Bavarian Nordic has donated 15,000 doses of JYNNEOS to be distributed in African countries. But that is a tiny fraction of the 10 million doses needed to control the outbreak, according to Africa CDC. The challenge is that these vaccines are not sufficient, even if countries try to protect only the people at highest risk, said Dr. Dimi Ogoina, a Nigerian scientist and chair of the WHO's Mpox Emergency Committee. LC-16 was used in Japanese children in the 1970s. Clinical trials funded by the Coalition for Epidemic Preparedness Innovations are now evaluating whether JYNNEOS can protect children and people who have already been exposed to the virus. Dr. Lurie said. The organization is also supporting the development of a new mRNA vaccine made by BioNTech that would protect against Mpox and related viruses, such as smallpox. This outbreak has been smoldering for quite a long time, and we continually have missed opportunities to shut it down, Dr. Lurie said. I'm really glad that everybody is now paying attention and focusing their efforts on this.